Question 1. Given the circumstances, Mr. Anderson is preparing to perform a radiographic exam of a patient with a suspected fracture in the femur. The patient is in severe pain, and Mr. Anderson needs to ensure that the correct positioning is achieved without causing further discomfort or injury. Which of the following techniques should Mr. Anderson prioritize to minimize patient discomfort and ensure accurate imaging? A. Use a general positioning technique without any adjustments for pain management. B. Immobilize the leg using a splint and adjust the positioning gently to avoid exacerbating pain. C. Position the patient without considering the use of immobilization devices to speed up the process. D. Attempt to perform the exam without checking the patient's medical history for contraindications. Answer. Correct answer. B. Immobilize the leg using a splint and adjust the positioning gently to avoid exacerbating pain. Explanation. In this scenario, the key concern is patient comfort and minimizing further injury, especially when dealing with a suspected fracture. Immobilization devices such as a splint can help prevent further movement that could exacerbate pain or injury. Gentle adjustments are critical in minimizing discomfort while achieving radiographic images. According to the ASRT standards on patient care during radiographic procedures, radiologic technologists are expected to balance patient comfort with diagnostic needs. The other options either neglect patient care, C, or fail to consider necessary precautions, D. The use of immobilization aids aligns with patient safety protocols and reduces unnecessary patient stress. Question 2. To determine the correct exposure settings for an abdominal X-ray, which of the following factors should be most influential in determining the optimal technique for the procedure? A. The patient's age and general health condition. B. The radiographic equipment model being used for the exam. C. The patient's body habitus and the amount of adipose tissue present. D. The patient's history of previous X-ray examinations. Answer. Correct answer. C. The patient's body habitus and the amount of adipose tissue present. Explanation. The body habitus, including factors such as adipose tissue, significantly influences the amount of radiation needed to penetrate the body and produce clear images. For example, thicker patients with more adipose tissue will require higher exposure settings to achieve adequate image contrast and clarity. ASRT guidelines emphasize the need for adjusting radiographic technique based on body composition to ensure optimal image quality while adhering to as low as reasonably achievable principles for radiation safety. The other factors A, B, D are less directly relevant to the actual exposure settings in this scenario, though they can play a role in overall patient care or diagnostic history. Question 3. From the perspective of radiation safety, how should a radiologic technologist handle a scenario where a patient is pregnant and requires an X-ray exam of the pelvis? A. Perform the exam without informing the patient of potential risks, as the radiation exposure is minimal. B. Use a higher radiation dose to achieve clearer imaging while advising the patient of the potential risks. C. Consider alternative imaging modalities such as ultrasound to avoid exposing the fetus to ionizing radiation. D. Proceed with the exam but provide no shielding to the abdomen as it is not necessary for this type of procedure. Answer. Correct answer. C. Consider alternative imaging modalities such as ultrasound to avoid exposing the fetus to ionizing radiation. Explanation. In the case of pregnant patients, radiation safety protocols must be strictly followed to protect the developing fetus from potential harm. The ALARA principle dictates that any exposure to ionizing radiation should be minimized and, where possible, alternative imaging modalities such as ultrasound should be considered. ASRT guidelines stress the importance of informing patients about the risks and considering their specific needs, including the potential risks to pregnancy. Performing an X-ray without proper precautions, A, B, D, would violate safety standards and ethical principles related to patient care, particularly in the context of minimizing radiation exposure to vulnerable populations. Question 4. Which of the following would be the most effective approach to minimize radiation exposure to staff during fluoroscopic procedures? A. Allow the staff to remain in the room for longer periods to assist with the procedure. B. Use lead shielding for staff and increase the distance between the operator and the radiation source. C. Keep the fluoroscope stationary and avoid using collimation during the exam. D. Increase the dose rate to reduce procedure time. And therefore the exposure. Answer. Correct answer. B. Use lead shielding for staff and increase the distance between the operator and the radiation source. Explanation. To minimize radiation exposure to staff during fluoroscopic procedures, both distance and shielding are the most effective methods according to radiation safety guidelines, such as those provided by the ASRT. Staff should be positioned as far as possible from the radiation source while utilizing lead shielding to protect against scattered radiation. Increasing exposure time or reducing collimation. Option C. D. Increases the radiation dose, which directly contradicts safety principles. Option A. Also increases exposure by suggesting staff remain in the room for longer durations. Question 5. In response to a situation where Mr. Adams must perform a routine chest X-ray, which of the following positioning techniques is essential to ensure the accuracy of the results? A. The patient should be instructed to breathe normally and remain in the upright position. B. The patient should be in a supine position with both arms above the head. C. The patient must take a deep breath in, hold it, and remain still while in the upright position. D. The patient should be seated in a chair to avoid movement during the procedure. Answer. Correct answer. C. The patient must take a deep breath in, hold it, and remain still while in the upright position. Explanation. For a chest X-ray, it is crucial that the patient takes a deep breath in and holds it, as this expands the lungs and provides a clear image of the chest cavity. The patient should remain in an upright position to avoid image distortion caused by gravitational forces on the chest organs. The ASRT emphasizes this procedure as for optimal image quality and accurate diagnosis. Options. B. Neglect essential positioning for image clarity, while option D would not offer the same diagnostic precision as the upright posture recommended. Question 6. During the process of performing a CAN on a pediatric patient, what is the primary concern when selecting the appropriate dose of radiation? A. The dose should be the same as for an adult, as pediatric patients are generally stronger. B. The radiation dose should be reduced to account for the increased sensitivity of pediatric tissues to radiation. C. The dose should be increased to ensure that the entire scan area is adequately imaged. D. The radiation dose should be adjusted based solely on the weight of the patient. Answer. Correct answer. B. The radiation dose should be reduced to account for the increased sensitivity of pediatric tissues to radiation. Explanation. Pediatric patients are more sensitive to radiation due to their developing tissues and higher metabolic rate. The ASRT recommends adjusting radiation doses to the minimum necessary for obtaining diagnostic images, particularly in children. This aligns with the ALARA principle, which is crucial in pediatric imaging. Increasing the dose, option C, or adjusting based solely on patient weight, option D, could unnecessarily increase the risk of radiation-induced harm. Consistent with radiation protection standards, reducing the dose appropriately is the most effective approach. Question 7. Which of the following best describes the role of a radiologic technologist when handling contrast agents during imaging procedures? A. The technologist should administer contrast agents only after confirming the patient's allergic history. B. The technologist should administer contrast agents independently without consultation with the physician. C. The technologist should ensure proper patient positioning before administering contrast agents. D. The technologist should focus only on the technical aspects of the imaging, not on patient preparation for contrast administration. Answer. Correct answer A. The technologist should administer contrast agents only after confirming the patient's allergic history. Explanation. One of the primary responsibilities of a radiologic technologist when using contrast agents is to verify that the patient has no known allergies to the contrast material being used. This is critical to prevent adverse reactions during the procedure. ASRT guidelines underscore the importance of proper patient screening, including an allergy history, before administering contrast agents. Although the technologist is responsible for ensuring correct positioning, option A takes precedence as it directly relates to patient safety and risk management. Question 8. What factors are most important when assessing the quality of a radiographic image? A. The amount of radiation exposure used to create the image. B. The resolution, contrast, and noise levels in the final image. C. The patient's age and overall health condition. D. The timing and speed with which the imaging procedure is completed. Answer. Correct answer B. The resolution, contrast, and noise levels in the final image. Explanation. The quality of a radiographic image is primarily determined by factors such as resolution, contrast, and noise. ASRT guidelines state that these factors are critical for accurate diagnosis as they directly impact the clarity and diagnostic utility of the image. While radiation exposure option A must be minimized, it is not the sole determinant of image quality. Patient characteristics option C and speed option D may play a role, but they are secondary to the technical aspects of image quality. Question 9. From a safety standpoint, how should a radiologic technologist approach a situation where a patient is exhibiting signs of claustrophobia during an MRI exam? A. Proceed with the exam, reassuring the patient and continuing as quickly as possible. B. Allow the patient to leave the room if they feel anxious and offer no alternative solution. C. Ensure the patient is well informed about the procedure and offer calming techniques or sedation as appropriate. D. Ignore the patient's concerns and prioritize completing the exam swiftly. Answer. Correct answer. C. Ensure the patient is well informed about the procedure and offer calming techniques or sedation as appropriate. Explanation. In MRI exams, especially for patients with claustrophobia, communication and comfort are paramount. Radiologic technologists should ensure that patients understand the procedure and provide calming techniques or offer sedation when appropriate. According to ASRT patient care protocols, it is essential to emotional distress and provide options for minimizing anxiety. Options A, B, and D fail to prioritize patient comfort or well-being, which could negatively impact the patient's experience and safety during the procedure. Question 10. When considering the biological effects of radiation, which of the following best explains the long-term impact of chronic radiation exposure? A. Chronic exposure primarily leads to immediate tissue damage that is reversible. B. Chronic exposure can result in mutations that may lead to cancer or genetic effects over time. C. Chronic exposure has no long-term effects if the radiation dose is below the recommended level. D. Chronic exposure only affects the skin and has no impact on internal organs. Answer. Correct answer. B. Chronic exposure can result in mutations that may lead to cancer or genetic effects over time. Explanation. Chronic radiation exposure, even at low doses, can accumulate over time and increase the risk of long-term biological effects, including genetic mutations and cancer. ASRT guidelines and radiation safety principles emphasize the importance of minimizing cumulative exposure and adhering to ALARA standards to protect against such risks. Option B reflects the well-established scientific understanding of radiation's long-term biological effects, while the other options underestimate the potential risks of chronic exposure. Question 11. When considering the principles of radiation protection in diagnostic imaging, what is the primary objective of the ALARA as low as reasonably achievable principle? A. To minimize the financial cost associated with radiation procedures. B. To reduce radiation exposure to patients, staff, and the public by optimizing imaging protocols. C. To ensure that all radiation procedures comply with local regulations only. D. To minimize the time spent in a radiology department. Answer. Correct answer. B. To reduce radiation exposure to patients, staff, and the public by optimizing imaging protocols. Explanation. ALARA is a fundamental principle in radiology that aims to minimize radiation exposure by adjusting imaging protocols to the lowest possible levels while still ensuring the quality of diagnostic images. This principle is essential to ensure safety for both the patient and the medical staff, as well as to with regulatory guidelines for radiation protection. Simply complying with regulations does not guarantee optimal safety, and minimizing cost or time does not directly address radiation safety. Question 12. Given the circumstances in a pediatric imaging scenario, how might a radiologic technologist ensure that a pediatric patient receives the most effective imaging while minimizing their radiation dose? A. Use a higher kVp setting to increase image clarity even if it increases patient exposure. B. Avoid using immobilization devices to reduce discomfort even if it results in repeated images. C. Apply age-specific dose reduction protocols. such as lower KVP, and utilize proper positioning and immobilization techniques. D. Always choose the highest radiation dose setting to ensure the clearest image in the shortest amount of time. Answer. Correct answer. C. Apply age-specific dose reduction protocols, such as lower KVP, and utilize proper positioning and immobilization techniques. Explanation. Pediatric patients are more sensitive to radiation than adults, and applying age-specific dose reduction protocols is essential for minimizing their exposure. Using lower KVP settings is effective in reducing radiation while maintaining diagnostic quality. Proper and immobilization techniques help ensure the best possible image quality without needing to repeat images, which can increase the radiation dose. Repeated exposures and higher doses should be avoided. Question 13. In response to a sudden emergency procedure, what is the primary legal responsibility of a radiologic technologist when performing imaging on a patient without prior consent? A. To inform the patient of the risks of the procedure as soon as possible. B. To perform the procedure immediately without informing anyone. C. To ensure that the patient understands all possible outcomes, including risks and benefits. D. To proceed with the procedure only after obtaining written consent from the patient. Answer. Correct answer. A. To inform the patient of the risks of the procedure as soon as possible. Explanation. In emergency situations, the law allows for the procedure to be performed without prior written consent if the patient is unable to provide it. However, the radiologic technologist must inform the patient of the risks and nature of the procedure as soon as they are able. Informed consent is a legal requirement, and the patient should always be made aware of risks and benefits even in emergencies. Question 14. What would happen if a radiologic technologist does not adhere to infection control procedures during a fluoroscopy procedure? A. There is no significant consequence, as fluoroscopy procedures are non-invasive. B. Cross-contamination may occur, leading to potential infections or the spread of diseases. C. The image quality may be compromised, but there is no impact on patient safety. D. Only the patient may be at risk if staff members are not affected. Answer. Correct answer. B. Cross-contamination may occur, leading to potential infections or the spread of diseases. Explanation. Infection control procedures such as hand hygiene and sterilization of equipment are crucial in any radiologic procedure, including fluoroscopy. Failure to adhere to these protocols can result in cross-contamination, potentially leading to hospital-acquired infections. Both the patient and staff are at risk if proper infection control measures are not followed. Question 15. When analyzing an abdominal radiograph, a radiologic technologist notices that there is a noticeable amount of scatter radiation affecting the image quality. What adjustment can be made to improve the image quality? A. Reduce the exposure time. B. Increase the KVP, millivolt peak setting. C. Use a grid to absorb scattered radiation. D. Decrease the focus to film distance. Answer. Correct answer. C. Use a grid to absorb scattered radiation. Explanation. Scatter radiation can reduce the quality of diagnostic images, leading to poor contrast. A grid is designed to absorb scattered radiation before it reaches the image receptor, improving image clarity and contrast. While increasing KVP can improve penetration, it also increases scatter. So the use of a grid is the most effective method for controlling scatter, improving image quality. Question 16. Considering the impact of radiation dose limits on radiologic technologists, how should a technologist manage their exposure when working in a high radiation area? A. Work as quickly as possible without taking breaks to minimize overall exposure time. B. Always wear personal protective equipment, including lead aprons and thyroid collars, and follow the principles of time, distance, and shielding. C. Decrease the distance from the radiation source to increase efficiency. D. Limit exposure only to the patient, as staff exposure is less of a concern. Answer. Correct answer. B. Always wear personal protective equipment, including lead aprons and thyroid collars, and follow the principles of time, distance, and shielding. Explanation. Radiologic technologists should always wear personal protective equipment, including lead aprons, thyroid collars, and gloves when necessary to protect themselves from radiation exposure. Additionally, applying the principles of time, distance, and shielding is essential in minimum exposure. Time refers to reducing the amount of time spent near radiation Distance involves increasing the space between the technologist and the source, and shielding involves using protective barriers to block radiation. Question 17. When considering the effects of radiation on biological tissues, which of the following is the most accurate statement regarding acute radiation exposure? A. Acute radiation exposure typically results in long-term health problems, including cancer. B. Acute radiation exposure primarily causes genetic mutations that can be passed to offspring. C. Acute exposure can cause immediate, noticeable effects, including radiation sickness, depending on the dose received. D. Acute exposure has no significant impact unless it exceeds the lethal dose threshold. Answer. Correct answer. C. Acute exposure can cause immediate, noticeable effects, including radiation sickness, depending on the dose received. Explanation. Acute radiation exposure can cause immediate biological effects, including symptoms of radiation sickness such as nausea, vomiting, and skin burns. The severity of the symptoms depends on the dose of radiation received. Chronic effects, such as cancer, generally result from long-term exposure to low doses. Genetic mutations due to acute exposure are less common compared to the long-term effects of radiation. Question 18. In a scenario where a radiologic technologist is performing a scan on a pregnant patient, what steps should be taken to minimize potential risks to the fetus? A. Proceed with the CT scan without any adjustments as the radiation dose is minimal. B. Use the lowest possible radiation dose and consider alternative imaging methods that do not involve ionizing radiation, such as ultrasound or MRI. C. Increase the radiation dose to ensure a clearer image for diagnostic accuracy. D. Only proceed with the scan if the patient is in the second trimester of pregnancy. Answer. Correct answer. B. Use the lowest possible radiation dose and consider alternative imaging methods that do not involve ionizing radiation, such as ultrasound or MRI. Explanation. Pregnant patients are more sensitive to radiation, and fetal exposure can result in developmental harm. To minimize risks, radiologic technologists should use the lowest possible radiation dose and consider non-ionizing imaging methods, such as ultrasound or MRI whenever feasible. The decision to perform should be carefully considered, and the benefits must outweigh the potential risks to the fetus. Question 19. What is the primary concern for a radiologic technologist when operating fluoroscopic equipment? A. Ensuring the image resolution is as high as possible, regardless of radiation dose. B. Protecting the patient and staff from excessive radiation exposure by minimizing exposure time and using proper shielding. C. Focusing primarily on patient comfort and convenience rather than radiation safety. D. Increasing the exposure time to guarantee optimal image quality for every patient. Answer. Correct answer. B. Protecting the patient and staff from excessive radiation exposure by minimizing exposure time and using proper shielding. Explanation. Fluoroscopy involves real-time imaging, and it is critical to minimize radiation exposure to both the patient and healthcare staff. The radiologic technologist should focus on reducing exposure time, using appropriate shielding, and positioning the patient to ensure the highest quality images while minimizing unnecessary radiation exposure. Question 20. During the process of imaging a chest X-ray, what is the most effective way to ensure that the radiograph meets quality standards for diagnostic purposes? A. Always increase the exposure time to ensure proper penetration. B. Ensure proper positioning, use appropriate technical factors, and confirm the patient's breathing technique. C. Limit the use of grids to reduce patient exposure. D. Allow the patient to hold their breath for as long as possible to reduce movement blur. Answer. Correct answer. B. Ensure proper positioning, use appropriate technical factors, and confirm the patient's breathing technique. Explanation. Proper positioning is essential to obtain accurate diagnostic images. In a chest X-ray, the patient's breathing technique plays a crucial role in preventing motion blur. Radiologic technologists should ensure correct positioning and the use of appropriate technical factors, e.g. KVP mass, to avoid unnecessary radiation while achieving high-quality images. Using grid is essential for minimizing scatter in chest X-rays. Question 21. Under the assumption that a radiologic technologist is performing a mammogram on a patient, what is the most important factor in ensuring a high-quality image while maintaining radiation safety? A. Reducing exposure time to a minimum regardless of patient comfort. B. Using the highest possible radiation dose to guarantee a clear image. C. Positioning the patient correctly, applying compression and using the lowest appropriate dose. D. Allowing the patient to remain in the room as long as possible to reduce image blur. Answer. Correct answer. C. Positioning the patient correctly, applying compression and using the lowest appropriate dose. Explanation. Proper positioning and patient compression are key in obtaining a high-quality mammogram. Compression reduces breast thickness, improves image clarity, and allows for a lower dose of radiation, while reducing exposure time is important for minimizing radiation. Correct positioning and compression directly impact image quality. Radiation dose should always be kept as low as reasonably achievable, while maintaining diagnostic image quality. Question 22. From the perspective of radiation safety, what should a radiologic technologist do when encountering a patient with a pacemaker who requires a chest X-ray? A. Proceed with the X-ray without considering the pacemaker as the radiation dose is minimal. B. Use the highest possible radiation dose to ensure the pacemaker is clearly visible. C. Avoid taking the X-ray and recommend other imaging methods, such as MRI. D. Adjust the exposure settings and position the patient to minimize the risk of pacemaker malfunction due to radiation. Answer. Correct answer. D. Adjust the exposure settings and position the patient to minimize the risk of pacemaker malfunction due to radiation. Explanation. While the radiation dose in diagnostic imaging is generally low, certain medical devices, such as pacemakers, can be sensitive to electromagnetic interference. A radiologic technologist must adjust exposure settings to minimize the risk of damage to the pacemaker, ensuring that the patient's safe. Prioritized. MRI should not be used for pacemaker patients as it can be harmful. Always ensure proper positioning to limit unnecessary radiation exposure. Question 23. Considering the biological effects of radiation, which of the following factors most significantly influences the amount of damage caused by radiation exposure to human tissues? A. The patient's age and sex, as they influence the overall sensitivity to radiation. B. The duration of the radiation exposure, with longer exposure leading to more damage. C. The type of radiation, as some forms of radiation are more damaging than others. D. The radiation dose, with higher doses leading to more severe damage to tissues. Answer. Correct answer. D. The radiation dose, with higher doses leading to more severe damage to tissues. Explanation. The amount of radiation exposure or dose is directly proportional to the extent of biological damage. High doses of ionizing radiation can cause significant damage to tissues, leading to acute or chronic effects such as cell death, mutations, and cancer, while other factors such as age and sex can influence radiation sensitivity. Dose remains the most critical factor in determining the extent of biological damage. Question 24. To illustrate this point, a radiologic technologist is conducting a fluoroscopy procedure on a patient. Which of the following actions should be taken to minimize radiation exposure to both the patient and staff? A. Keep the fluoroscopy procedure as short as possible and use lead shielding for the patient. B. Keep the fluoroscopy procedure as long as possible to ensure high image clarity. C. Allow the patient to move during the procedure to reduce radiation dose. D. Avoid using lead shielding as it may affect image quality. Answer. Correct answer. A. Keep the fluoroscopy procedure as short as possible and use lead shielding for the patient. Explanation. Minimizing exposure time and using lead shielding are key practices for reducing radiation exposure. Fluoroscopy involves real-time imaging, which can lead to higher radiation doses. Therefore, the procedure should be conducted as briefly as possible to minimize exposure while maintaining image quality. Using lead shielding, protect both the patient and staff from scatter radiation. Question 25. Given the circumstances a radiologic technologist is preparing to perform a scan on a patient who is obese, what adjustments should be made to the scanning procedure to ensure optimal imaging while minimizing radiation exposure? A. Increase the radiation dose to account for the patient's body size. B. Decrease the radiation dose to prevent further complications in obese patients. C. Utilize a higher contrast agent dose to compensate for the patient's size. D. Use the lowest possible radiation dose while adjusting scanning parameters such as slice thickness and A. Answer. Correct answer. D. Use the lowest possible radiation dose while adjusting scanning parameters such as slice thickness and KVP. Explanation. For obese patients, it is important to optimize CT scan settings to reduce radiation exposure while maintaining image quality. By adjusting parameters like slice thickness and KVP, the radiologic technologist can achieve optimal imaging with minimal radiation, increasing the dose avoided unless necessary, as it increases the risk of radiation-related health concerns. Always apply the ALARA principle to all patients. Question 26. In light of recent developments in imaging technology, what is the primary benefit of digital radiography over traditional film-based radiography? A. Digital radiography produces a higher radiation dose to the patient. B. Digital radiography provides better spatial resolution and contrast. C. Digital radiography reduces the need for patient positioning accuracy. D. Digital radiography eliminates the need for proper equipment maintenance. Answer. Correct answer. B. Digital radiography provides better spatial resolution and contrast. Explanation. Digital radiography offers several advantages over traditional film-based radiography, including superior image quality, better spatial resolution, and enhanced contrast. These benefits enable radiologists to detect abnormalities more clearly. Digital systems also allow for easier image manipulation, reducing the need for re-exposure in some cases. However, proper positioning and equipment maintenance remain essential, even with digital technology. Question 27. Which of the following is a critical aspect of a radiologic technologist's role in ensuring patient safety during a radiographic procedure? A. Providing a detailed explanation of the procedure and addressing any patient concerns. B. Focusing primarily on achieving the best image quality at any radiation dose. C. Limiting patient exposure to the minimum necessary while ensuring diagnostic image quality. D. Avoiding patient communication during the procedure to reduce distractions. Answer. Correct answer. C. Limiting patient exposure to the minimum necessary while ensuring diagnostic image quality. Explanation. The radiologic technologist is responsible for minimizing the patient's radiation exposure while still obtaining high-quality diagnostic images. This aligns with the ALARA principle, ensuring that radiation is used safely and efficiently. Patient communication is essential to ensure their comfort and understanding of the procedure, which can help with positioning and cooperation. Question 20. When analyzing the potential biological effects of radiation on cells, what is the most significant factor that determines the level of damage a cell can experience? A. The type of tissue the cell belongs to. B. The sensitivity of the cell to radiation, known as the radiosensitivity of the cell. C. The amount of oxygen available in the tissue. D. The overall age of the patient receiving radiation. Answer. Correct answer. B. The sensitivity of the cell to radiation, known as the radiosensitivity of the cell. Explanation. The radiosensitivity of a cell is one of the most important factors in determining the level of damage a cell sustained from radiation. Rapidly dividing cells, such as those found in bone marrow, are typically more sensitive to radiation. Oxygenated tissues are also more vulnerable to radiation-induced damage, a principle known as the oxygen enhancement ratio. However, the radiosensitivity of the cell itself is the primary determinant of radiation-induced damage. Question 29. What would happen if a radiologic technologist fails to follow proper sterilization and infection control procedures while performing a diagnostic imaging procedure? A. The patient may experience slight discomfort, but no significant consequences will occur. B. Infection transmission can occur, leading to potential harm to the patient and others. C. Only the radiologic technologist is at risk of infection, and it does not affect the patient. D. The imaging procedure will be delayed, but there will be no long-term consequences. Answer. Correct answer. B. Infection transmission can occur, leading to potential harm to the patient and others. Explanation. Sterilization and infection control procedures are critical to preventing the transmission of infections during diagnostic imaging procedures. Failure to adhere to these protocols can lead to hospital-acquired infections, which can harm the patient and potentially spread to others, including healthcare workers. Infection control is a key aspect. Patient safety and quality care in radiologic practice. Question 30. During the process of handling a pregnant patient requiring a diagnostic imaging procedure, which of the following is the best approach to minimize radiation risks to the fetus? A. Use the standard imaging protocol without adjustments to the radiation dose. B. Consider alternative imaging techniques that do not involve ionizing radiation, such as ultrasound or MRI. C. Increase the radiation dose to ensure a clearer image. D. Always avoid performing any imaging procedure on a pregnant patient. Answer. Correct answer. B. Consider alternative imaging techniques that do not involve ionizing radiation, such as ultrasound or MRI. Explanation. For pregnant patients, radiation exposure can pose significant risks to the developing fetus. Non-ionizing imaging techniques such as ultrasound and MRI are preferable alternatives when possible. If imaging with ionizing radiation is necessary, steps should be taken to minimize the dose, e.g., using shielding, lowering kVp. It is not always appropriate to avoid imaging altogether, as certain medical conditions may require diagnostic imaging.